Alloclae is an innovative FDA-approved injectable filler made from processed donor fat tissue used in cosmetic procedures to add volume, smooth contours, and create a more youthful appearance.
Dr. Otto J. Placik joins us now to break it all down. Thank you so much for being here.
Oh, thank you for inviting me, Amy and Tanya.
This is fascinating. So this is harvested from a cadaver, and then it goes through a process to clean it? Is that how it's used?
Yes, we would say bioengineered injectable donor fat.
Okay.
And they actually take it from donors. They're not compensated for it.
Okay.
And so it's random. There's no benefit to them other than donating to science, essentially.
Okay.
Okay. And these are all cadavers. Are there any human or living donors?
No, there is a different process of doing that to yourself, for saving it for yourself. But there is no currently living donor. The process of going through this is so tedious and so prohibitive that you can't do it for just one small amount of fat. So when they harvest, they want to collect a larger amount and then process into larger volumes.
Okay. We were talking about this in the break. So many people on injectables these days. There's a lot of weight loss going on. So what typically we would have done a fat transfer, say, from your butt to your breasts or something like that if you wanted volume. Now you're using that instead, correct?
Correct. Not quite that volume,
Okay.
but oftentimes in the past you would use donor fat. That's ideal.
Okay.
But in today's age, we have a lot more physically fit people, lean people, or people who have lost a lot of weight, and they seek contours that can't be achieved with normal fillers, or that's cost prohibitive.
Okay.
So this plays a middle role where it can give you a large amount of volume, let's say about 100, 200, 300 cc's, potentially more in the future, which is about 3 to 5 ounces.
So we're talking BBLs. What are we using this
So
for?
right now we're doing this on the fringes of that. What we're doing is more hip dips. So the contrast on the outer thighs where you don't need as much volume as a BBL, which is a Brazilian butt lift, which most people know colloquially now.
Yeah.
But typically you would put in like 800 to 900 cc's in a BBL. For here you're putting in anywhere from 50, I've put up to 200 in some people per side.
Wow, that's
And you're also doing this to get rid of cellulite?
Yes, it can be combined. So there's other technologies also made by this company, Tiger Aesthetics, that provides a release of the cellulite fibers.
Okay.
So cellulite's a problem of 3 things. It's deflation, it's tethering, and then it's like loose skin. What this addresses is filling the area, so then it's plump, and then when you release the attaching ligaments, they pop out.
Oh, fascinating.
So it's almost like releasing a quilting, on a suture, on a quilting blanket.
That's fascinating. Now, are people doing it in their face at all yet, or are we there yet?
So that's the next, I was talking about that,
Okay.
that's the future. Currently we have Alloclae, and because we're trying to preserve the architectural integrity, it's done through a 2.5 millimeter cannula, which is larger than we usually use for the face.
Okay.
In the next year, they're going to roll out what's called Dermaclae, which can be injected through a 20 gauge cannula, which is more commonly for the face, and more delicate, refined injections around the eyes, the lips, jawline.
Wow.
How long does it take to see the results, and how long do the results last? Do you have to have another injection?
So it's really only been out about a year, really, in wide use. That's hard to say. We think it may be permanent in the sense that, cadaver donations have been around for a long time. We've used bone grafts forever, probably the past 10, 15 years. They take a bone graft and they put it in. Over time, your body replaces that natural bone structure with your body's own bone. And this is going to be put in, and over time it's going to replace it. And they've done biopsies later where your own fat has inhabited where the Alloclae was.
So does this go exactly where you place it in the body, or is this something that you can manipulate to spread out too?
No, it pretty much, and that's why I'll show you in a little demonstration later, but this is essentially, if we can just show you right here, and of course this is not true Alloclae. I don't want to waste human tissue. But you inject this, and as you inject and push on the plunger, you would be putting out the Alloclae like that in tissue. Now when you're doing it in tissue, it is more in a suspension. So this is gelatin, and you can see that if we're laying it in, we're laying it as a layer, and it stays right at that layer. If I want to go deeper, I want to go deeper there. If I want to go more superficial. So this is used sometimes to correct dimpling, liposuction irregularities, enhance the cleavage area, camouflage implants. Some people lose a lot of weight, you can see the edges or border of an implant, and so you can feather it. around the edge of that, and you can see it just stays suspended in space. I say it's almost like putting bubble gum in your hair. It doesn't really move.
Right.
You're not putting it into a space, you're putting it into a gel matrix, which is essentially, it's FDA approved to inject anywhere fatty tissue is located, which is pretty much everywhere in the body.
Everywhere in the body, right?
My gosh, we could talk to you for an hour for this. Doctor, thank you so much. This is fascinating. Unbelievable. For more information, visit bodysculptor.com.